The SemiFlex Flexible Ureteroscope from MaxiFlex. The SemiFlex scope is a revolutionary new way to perform safe, effective, and cost-conscious flexible ureteroscopy. It is a disposable hybrid endoscope, having both semi-rigid and flexible endoscopic features, and attaches to a reusable eyepiece and coupler. The SemiFlex has an ergonomic deflection trigger, an ACMI and Storrs-style light source connector, and a lure lock for irrigation and insertion of endoscopic instruments. The scope shaft is 7.85 French in diameter and non-tapered for greater patient comfort. It is offered in 45, 55, and 60 centimeter lengths. The shaft contains a 10,000 pixel optical bundle and lighting fiber that offers physicians an excellent image quality. The SemiFlex has a 3.4 French working and irrigation channel, which allows for physician use of 0.035 inch or less endoscopic tools, including laser fibers, baskets, or forceps. There's also an iridium band at the distal tip for viewing under fluoroscopy. The 8 centimeter deflection tip can articulate bidirectionally up to 210 degrees, allowing easy access to every part of the urinary tract. 2 deflection options are available for physician preference: a standard deflection tip or a dual deflection tip. The SemiFlex comes sterile and before use should be removed from the carrying case and inspected from the scope body to the end of the shaft for any indication of damage during delivery. In order to use the SemiFlex scope, the eyepiece must first be attached to the SemiFlex by removing the red dust cap and screwing the eyepiece to the proximal end of the SemiFlex by holding the ocular end of the eyepiece and making sure the connector is secure. Do not over-tighten the eyepiece. When taking off the eyepiece, remove it from the proximal end closest to the scope. Next, remove the black cap over the light cord connector and snap the light cord to the SemiFlex. Once attached, the physician should pre-focus the SemiFlex by looking through the eyepiece and making sure the SemiFlex is in focus. If it is not in focus, the focusing ring on the eyepiece should be adjusted to the correct focal point. Once the SemiFlex has been properly pre-focused, the universal camera head may be attached to the eyepiece, making sure the camera image is also in focus. A defined circular image should be seen on the surgical monitor. At this point, the physician should white balance the scope with a sterile 4x4 on the drape sheet. Once a clear picture has been obtained, the physician should attach the multi-port irrigation attachment to the lure lock on the scope body, which allows for simultaneous irrigation and insertion of endoscopic instruments. A pressure irrigation system is recommended for optimal irrigation flow. Lubrication should be added to the distal end of the scope, making sure not to get any on the scope lens. The SemiFlex is now ready for introduction. Because of the semi-flexible style shaft, the SemiFlex should be held in the horizontal position, similar to that of a semi-rigid scope. The shaft should be kept as straight as possible. It is recommended that users become familiar with the direction of the tip deflection before introduction. The SemiFlex deflects left and right on the same plane as the patient. Also, because of the rigidity built into the shaft, up and down deflection may be obtained by a rotation of the wrist. Introduction of the SemiFlex into the ureter can be achieved either through an access sheath or by backloading on a 0.035-inch super stiff guide wire. Physicians should note that there is a 2-to-1 ratio of degrees of tip deflection in regards to trigger deflection. When the trigger is deflected 45 degrees, the tip deflects 90 degrees. When the trigger is deflected 90 degrees, the tip articulates 180 degrees. Timing of articulation is very important in accessing the calyces. Understanding when to start deflecting the SemiFlex and the amount of deflection will determine whether the physician is able to access the intended calyce. Starting to deflect too late can be detrimental to accessing that intended calyce. There is normally a 3 to 5 case learning curve for physicians with the SemiFlex. It is recommended that physicians use a conservative approach to the learning curve and follow the training case selection learning curve, starting with a solitary ureteral stone in the upper ureter or solitary renal stone in the mid or upper calyces. Stones in the lower calyces should only be attempted by physicians with prior experience with the SemiFlex. please review the patient selection guide for further information. The SemiFlex greatly reduces a facility's repair expenses and shortage of scopes due to repair downtime, making it easier and less costly to always have a scope available. The SemiFlex Flexible Ureteroscope, a revolutionary new way to perform safe, effective, and cost-conscious flexible ureteroscopy.